Hi there, Dr. E Simckes, Fertility Partnership, coming to speak to you today just to clear up a common mistake that I see in patients coming in. People come in and they often confuse these two terms, PGS and PGD. PGS is pre-implantation genetic screening and PGD is pre-implantation genetic diagnosis. The process for doing it, as far as you're concerned, and what happens to your embryos is the same, but the information is quite different. So what is it? So basically, we will do in vitro fertilization on you. We will develop embryos, take them out to day 5 or to day 6, when we have what is known as a blastocyst. This is a mature egg, day 3 and a day 5. You see this little area right there is called the inner cell mass, and that is the actual baby. And this area over here will be the placenta. Our embryologists will get under the microscope and pull out 3 or 4 cells over here. There are 120, 150 cells on day 5, day 6, and we can very safely remove a few cells. They get put on a slide and they get sent off to a company, to a lab that knows how to test those cells. So up until this point, PGS and PGD are the same thing. Now, we don't put these embryos in fresh, usually. We would freeze them. Why? Because it takes time to get the results. We used to put them in next day, 24-hour turnaround, but we weren't happy with what we saw, so we freeze. So you would go through your IVF, make your embryos, get them biopsied, frozen, and then you come back a couple of months later. So now your cells are off to the lab. Now, I won't get into the different kinds of processes to go and test, but in a grander scheme of things, genetic screening is looking for one answer, and that is, what is the chromosomal makeup of your embryos? Does it have 46 chromosomes, like any normal human cell, human embryo, human cell? 46XX is a girl, 46XY is a boy. For those of you who have nightmares from high school biology, I'm sorry, 46XX, 46XY is a boy. So we would not want, for example, 47XX21, which would be a female with an extra 21 chromosome, otherwise known as Down syndrome. So we would be screening for those big genetic problems. It's very useful. The American Society for Reproductive Medicine currently recommends that you undergo PGS if you are over age 38. It's also important to consider it if you've had lots of miscarriages. It's also important to consider if there's a strong family history or if you've had a baby with a genetic problem beforehand. This is something that you need to talk over with your doctor. At Fertility Partnership, we don't insist on you undergoing PGS in order to get a transfer from us. Many programs are going that way. I think it adds a lot of expense, and that's a long, big argument that, in all fairness, we should have someone from the other side here to debate with me, but we'll put that off. But certainly PGS is very important, and every cycle we do many cases. PGD. Your cells are gone, but they're not looking to see how many chromosomes you have. They're looking for a specific disease. So most of the diseases that we're looking for are diseases that if the mother is a carrier and the father is a carrier, then the child might be affected. What does carrier mean? You need 2 copies of the gene, one from the mother, one from the father, in order for the disease to progress to the child, all right? Again, nightmares from high school or middle school, Mendelian genetics. If you remember Mendel with his beans. Anyway, so autosomal recessive, the parent is not affected or mildly affected, and the offspring has a 1 in 4 chance of getting that disease. So let's say cystic fibrosis, which is about 1 in 35 people in the United States. So we often see a husband and wife come in and they're both carriers. That means every 4th child of theirs will have cystic fibrosis, which is a disease we've made a lot of progress on, but if it still ends with an earlier death for people. And so it can be diagnosed in the embryo. How do we do it? We take these cells, and then they can specifically target in the DNA that we send them in these 3 or 4 cells to see if this embryo has the disease, in other words, 2 copies, has a single copy, which makes them a carrier, which you could transfer, put that baby back in, or completely free of any of the disease. Classic diseases that we check all the time for are not that. Are cystic fibrosis, sickle cell anemia, Tay-Sachs disease, and there are literally hundreds of other diseases that we can look for. So, PGS, PGD, 2 separate concepts that in essence mean the same for you. PGD is more expensive, uses more advanced technology. Fertility Partnership offers all of this, of course, and we would look forward to helping you on your journey. Give us a call at 636-441-7770 and know that we will do our best. If you come here, we'll put our heart into it. Thank you.